Hello, I'm Dr. Sanjay Panicker. I'm the founder and managing director of Amrita Homeopathy. We are placed in two locations. One is in Koramangala and the other is in Marathali in Bangalore. We specialize in hair and skin problems, respiratory problems, allergies, pediatrics, infertility, and gallstones. Typhoid is a type of continued fever caused by an organism called as salmonella typhi. Now, an infection with this organism can lead to fever which is continuous, and there is usually a stepladder pyrexia. I remember a friend of mine who developed typhoid and was admitted in a hospital and was on treatment with homeopathic medicines, and the fever was going up step by step every day, and the patient was on some remedy, and initially in the 200 potency, and later some other doctors saw him and then gave some other remedy, and then it got messed up because they kept giving one remedy after the other, and the fever started going higher and higher and higher until one fine day the temperature went so high that it affected his brain and he actually got paralyzed and paralyzed for his life. So that is how badly you can affect the life of a person if you don't deal with a condition like typhoid. In typhoid, there are patches which can form in the intestine and which prevents the absorption of the nutrients that you're taking on your daily basis. Typhoid is very difficult even for a doctor to treat. What to say to treat at home is even more difficult. A mild case of typhoid, maybe you can deal with it, but if it is severe, then you will actually have to hospitalized, or you may have to monitor it very closely when you're on homeopathic medication. Homeopathic medicines can help to deal with it. There are wonderful remedies like Bryonia, Arsenic, baptisia, and carboveg, China, lycopodium. All these remedies, when the symptoms are indicated, are very helpful in treating and curing typhoid cases. I have had cases which got completely cured with baptisia. There are also cases which have cured with Bryonia. There are cases which have got cured with arsenicum. There are certain group of symptoms which come up when the remedy is indicated. The only problem is typhoid is not your regular fever. So don't expect it to go away in just a few doses. Today you will take and by tomorrow the fever is better and day after tomorrow it's even better. It may not practically happen. Some cases do respond fast, but usually that's not the scenario in typhoid. You have to wait and you need to be sure about what you're giving. You need to be doubly sure about what you're giving. Don't go for patent medicines. It may work, may not work. But if you're sure about what homeopathic remedy you're giving, you give it, observe it, repeat the remedy when the symptoms are recurring, and then keep doing that until the patient's fever comes down. In a proper remedy selection, you will see that the stepladder pyrexia is there. The fever is going up and up and up. But after the homeopathic remedy, the same way the fever comes down in the same stepladder way, and eventually it disappears. When there are no symptoms also, and there is no fever also, don't stop the medicines. Continue the medicine until the gastrointestinal symptoms like constipation or diarrhea or loose motion, everything is gone. Continue that particular remedy till it is completely clear. Sometimes the titer levels may still show typhoid, that is, the widal test may still continue to show that you are positive for typhoid. That may continue. Persist on the medicines till everything becomes normal and then only stop the medicines. As far as diet is concerned in typhoid, it's always better to go on a very simple carbohydrate diet, and if required, maybe you can use vegetarian proteins. Non-veg may be too heavy for the body to digest sometimes, especially with typhoid. There are Peyer's patches which are forming in the intestines, so absorption of the nutrients itself becomes difficult. And so when you take something which is very heavy, too fatty, too oily, too even heavy to digest high protein foods, non-vegetarian proteins, it becomes difficult for the body to digest that, and the patient may actually develop more diarrhea, more constipation and issues like. So vegetarian proteins or fruits are more easy for the body to take up at that time, and fruit juices are especially helpful. Instead of curd, buttermilk would be easier for the body to take up, and it will actually help the patient. Tender coconut is very useful during typhoid. So regular supplementation with ORS or tender coconut is important to rehydrate the patient, because the patient gets dehydrated otherwise. So these are some of the things that you can do when a patient is having typhoid. Keep giving water. See that there is not too much oily food, fatty food, not too heavy to digest kind of food, and of course no smoking and alcohol during typhoid.